We started it in 2022, and it really started after what I call dual disasters. COVID hit COVID hit in 2020, and then George Floyd was killed in 2020. And based on that, all of that, we began to realize that helping people get prepared for a disaster was not enough. If you think about an iceberg, what we had been doing was above the surface, but the real problems are below the surface. It's those barriers that are causing people not to be resilient. And so we also realized that disasters don't cause inequities, because not every community goes through a disaster in the same way, right? And so we realized that disasters don't cause inequities, but they definitely highlight them and exaggerate them. And so the Arc of Safety Community Resiliency Summit, our first one was, I think, September 14th of 2022, when we brought whole community together, leaders across the inland region, to say, what are those barriers? What are those things below the surface? Let's take a deep dive, and let's see, what are those things that are causing people not to be resilient? And what can we do to chip away at that iceberg below the water? The Titanic didn't sink because of what they saw. They sunk because of what was under the water. Well, first of all, I grew up in Independence, Missouri. Independence is the home of Harry Truman, President Harry S. Truman. I literally grew up on Truman Road, probably a mile and a half from his house. And in junior high school especially, my junior high school was around the corner from his house. So I got to see him after he retired, sitting on his front porch, walking around town, that kind of thing. But I also grew up in the church, in the Baptist church. And there were 5 black churches in our town. And when something would go awry, or even celebrations, it was the church community would come together. And I lived with my grandmother from the time I was 10. So there was no such thing as babysitters in the 50s. Now you're going, wherever it was. So I found myself being the little kid in the back of the church a lot, listening to the adults. So as adults, we have to understand that we're influencing children even when we don't realize it. They're listening, they're hearing. And the thing besides all the racism that I experienced in school, because I was...
What was some of that racism that you experienced?
Well, I was in the very first class when Independence School District integrated the schools after Brown versus the Board of Education, right? And I'll give you one example, and it's still hard. I remember walking to school past another junior high school because they had redlining. We couldn't live south of a certain street. And so those kids that lived past that area, in that area, got bused to the junior high school, which really wasn't that far from my junior high school. So when we were walking to junior high school, they would be on the bus, and they would, school bus windows, you pull them down, right? And they would call us the N-word. Every day. Every day. And you had to try to figure out how not to take it in and to say something back. Because whoever the adults were on the bus didn't stop them, right? And it's not like we could go on the bus and beat them up. I didn't realize until I was an adult working in corporate America how much all of the racism that I had experienced growing up had impacted me. I was the first employee at Edison, I'll say it, at Edison, to develop diversity training. And for the top 500 salaried employees, which would have been, supervisors on up to the CEO. And it wasn't until I was in the diversity classes that I realized what was in me and what was coming out. And I got to the point I couldn't be in the classes. I just couldn't. And then I got to the point to where I could sit in the class. It became a mission for me. I could sit in the class. And then ultimately, when I retired from Edison in 2000, I actually went out as a consultant and I taught diversity classes as a contractor. So I feel like I was healed. But even from that, but even now, sometimes I'm surprised when there's a trigger, and then I have to go, where did that come from? Yeah, you know what? I had some amazing role models growing up, and like I said, just being there and watching and seeing how the adults handled things. I mean, one of the worst things that happened for our community, there was a historically Black community that when President Truman was going to build his presidential library, it was going to look down on this neighborhood with outhouses and chickens and goats and no, that was not going to work. And so they did urban renewal and they got rid of the entire community. And I was sitting in the back of the church and listening to my grandmother and all the adults talking about what do we do and how can we stop this. I experienced urban renewal, 3 times before I graduated from high school. So that community, and then we lived on Truman Road. They tore it out, and and we moved to another community, and they tore it out, and we moved to another community. And so those kinds of things. That one in particular, they called it the Neck. It's historical. I remember saying, but Lord, I'm just a little kid. I can't do anything about it. And I remembered later that God said, but one day you will. So to answer your question, I believe it's my turn. Everything that I saw happen as a kid, including the civil rights movement with Dr. Martin Luther King and Ralph Abernathy and, many, John Lewis and many others, they're gone. It's our turn. It's your turn. I do genealogy, and I can look at the census and I can look at all the information from my ancestors, but I don't know them. Even my grandmother, for as long as I lived with her, now I would ask her questions, different questions, right? And so I started writing for my grandkids and my descendants. I want them to know me. When they say COVID happened, what did she do? How was she involved? I want them to know I did something. I think we all have a purpose on this earth. I never thought I would be doing it here in Southern California. And there are times I say, Lord, why am I not in Independence, Missouri doing this? But I'm here. And I feel compelled. Honestly, my ex-husband decided to go back into the Marine Corps. He's my ex-husband now, but he wasn't then. And so he and I drove, all our little worldly belongings. And at 21, I was 21, and we drove from Independence, Missouri to Santa Ana, California, and he went back into the Marine Corps in El Toro. And yeah. Yeah, in so many ways. But I don't know that anybody could have been really prepared for COVID, But I'll give you an example with the churches, right? Some of them were already online, but many of them were not online. And so that was a big change. How I was teaching pastors how to use Zoom, initially. And things were changing so rapidly that we started a series called Faith Over Fear, and on Zoom every day. And things were changing like every 15 minutes. We were getting new information. And so I was able to share it with the church leaders. Well, I should say house of worship leaders, because it wasn't just Christian churches. We had everybody. Everybody was there. The Jewish community was there. The Islamic community was there. Christian Science. We had everybody there because everybody needed to know. And they're the trusted messengers. And so if we could get the word out to them, they could spread the word, and they could spread the truth. The truth. You needed factual information, because if you remember, there was so much misinformation, going on. But that was a big one right there. Even being able to take, tithes and offerings online. Many of them didn't have that. The Catholic Church, and the way they do sacrament, with the priest putting it in they couldn't do that anymore. Everything changed. Well, first of all, I feel like people are forgetting what we learned during COVID, and I think that's a sad thing.
In what way do you think? Like, what specific?
People are going back to business as usual.
And that's kind of how things always go too.
It is. But some of the things that we learned in a very deep way, and part of it, we would say it, but now we've experienced it and now we live it, right? People in the community need to see people who look like them, right? Go to where the people are. That's what we do, right? Don't make them come to you. Go to where they're already gathering. If they're having some sort of a festival or they're at church, I mean, we had a lot of the clinics in the Black churches because with Riverside County Public Health, they asked us to take the lead on COVID response for the Black community. I'm Black, and I'm a person of faith. I understand that culture. It's really simple for me, right? And so we said we got to get the Black churches on board, which many of them we did, and we had the clinics there. People, they might have a church service, and after service, go right over to the fellowship hall and get your vaccination, right? They feel safe. They know the people. I'll give you an example. One woman, she almost died from COVID, and once she got better, she felt led to come and get her vaccination. But literally, when she walked in the fellowship hall, she literally was so afraid. She was shaking, physically shaking. And I happened to be there that day. And so I started talking to her, and she told me her story, how she almost died, and she had other family members who also had it, and really, really bad cases of COVID. And she said, I know God told me to come and get vaccinated, but I'm so afraid. And I said, would you like me to pray with you? I knew that would be okay because of where we were and who she was. And she said yes, and I prayed for her. And then I sat and I talked to her and distracted her until it was time for her to get her shot. And I stepped back, because privacy, that's what I needed to do. And she was sitting in the chair, and I'll never forget, she called my name and she said, where are you? And I asked the nurse, I said, can I come up? And they said, yeah. I literally held her hand and distracted her, talked to her and distracted her while she got her shot, her first shot. And she, it's like she didn't realize she had the shot, like she was done, right? And when it was time for her to get her second one, she called me. And she said, I've got to go and get my second shot. Are you going to be there? And I said, I will be there. I changed my whole schedule so that I could be there for her. That's the kind of trusted messengers that we need to have, boots on the ground in the community, whether it's COVID or anything else. In the last year, 2 years now, I'll say since January 20th of 2025, immigration. People don't come out of their houses. People are afraid. I'm not just talking about people who are undocumented. I'm talking about U.S. citizens who are carrying their passports, who are carrying their birth certificates, who are, afraid to send their kids to school. That's not okay. It shouldn't be that way. Probably 2 things. One, there's been a lot of work done to help Spanish-speaking people. And in some of the meetings that I've been in, I have raised my hand and said, but what about the people who are not Spanish-speaking, who are undocumented? Haitians, Jamaicans, Africans, whoever they are, who's helping them? That's one thing. Even in that, there's inequality. you know, who gets helped, who doesn't get helped. The other thing, in the Palm Springs area, Coachella Valley, you know, a lot of resort workers there. And people don't think about it. They're like, kind of like the cruise environment, you know, they're from various countries, but they're here working. And who's helping them? And we hear a lot about what's happening in LA and ICE, but it's happening out here. And who's covering it? You know, so even in the media, it's not equal. There's not equal coverage, right? I think about one family that one of my staff members shared with me. They're all undocumented. They stopped going to the doctor. They stopped going to church because there's the threat that they're going to go into the churches. One person was waiting for his visa to be renewed. Totally legitimate. None of these people have been arrested for any reason, right? His visa was denied, and now he's afraid. He's in college. Now he's afraid to go anywhere. Oh my goodness, completely. Communities of color that have already experienced historical trauma, generation after generation after generation. And now all the noise that's going on now just impacts it, it compounds it. It's what's causing high blood pressure, diabetes, you know, stress. It's what's causing it. And because sometimes we don't realize that we're carrying that historical trauma, we don't know why our health is poor. It's not just that we eat bad food. Well, food is good, but bad for us. Just the healthcare system itself. Whether you have access to healthcare. I live in Beaumont. We're Kaiser. Closest Kaiser is Moreno Valley or Fontana. Hospital, emergency room. You've got all these senior communities out there. No Kaiser. You know, paramedics take you to the closest hospital, 5 minutes away from where I live. But if we need to be transferred to Kaiser, or if we're trying to go to Kaiser, we're advocating, I'll say it that way, with the paramedics to bypass the closest hospital and take us where we really belong. And if they do take us to the closest hospital, then we're advocating with the hospital to transfer us to Kaiser. And I'll give you an example. My husband got COVID, and he was not in good shape. And he had to go to the emergency room. And it took from 8 o'clock in the morning to 8 o'clock at night to advocate. And I'm saying advocate nicely with the physicians to transfer him to Kaiser, who was literally waiting for him. They wanted to send him home because COVID's not like it was originally. But people are still dying from COVID. People have to learn how to advocate. Communities of color, some people have the culture of doctors knows best. Even if they're giving you a prescription, they just take it. They don't necessarily really know what it's for. They just take it because the doctor said so. Or we have the opposite, where we'll go to the doctor because they experimented on us, right? We don't trust them, right? Or now we can't go because we might encounter ICE. I mean, there's so many things. And then even in the healthcare system itself, the biases within the system. I mean, we hear so much about Black maternal health, and how our babies in 2026 are dying because they won't listen to us. They don't understand the culture, or they think whatever they think. Yeah, so let me just talk about air quality. Depending on where you live, along the freeway corridors, whether it's the 10 or the 15 or the 215 or, whichever one it is, they tend to build the factories in those areas. I think of Colton. There's a saying, if you're not at the table, you're on the menu. And the residents of those communities, Victorville, Apple Valley, Barstow, they have the meetings when they're at work. They can't just take off, and they don't advertise it to let you know. So the health, because of the air quality, let alone adding on the wildfire smoke on top of the trucks and all the vehicles and the warehouses and, all the things that are happening, it's causing more people to have respiratory illnesses. Even in the rural areas, like what Hesperia. I mean, all along that corridor there, Hesperia, Victorville, Apple Valley, Barstow, I don't know how long you're going to be here today, but this afternoon, Tamika Foots-Rochelle is going to be sharing a report out. We've been doing surveys on air quality, and we have over 500 people that have participated at this point, and we're not finished yet. But they're telling us what the problems are with the air quality. And we've talked to people all the way from Barstow and, these places you're mentioning, all the way to Blythe. We go out to Blythe. A lot of agencies don't. We've always educated, right, the communities. But in the last year, because I am a part of the Champions for Change vital conditions for IEHP Foundation, and part of that, it's all about learning how to advocate and, educating our elected officials. And I remember being in Sacramento earlier this year and saying to every elected official that I had a chance to speak with, and we did it in teams of 4 to 5, we would go in and talk with them. And every one of them, I would say, we're the boots on the ground. We're the trusted messengers. We have the ear of the community, of the residents. If you have ideas, talk to us. You need to talk to us. We need to learn to work together. Our biggest thing is breaking down silos, whether it's with elected officials, other nonprofits, this whole idea of being competitive because there's so little money, grant funding or, money, that has to go away. It has to stop. This summit is all about we must work together and stop seeing each other as competition. We elected you, folks. Even if we didn't vote for you, you got elected. Work with us. They're in an echo chamber, and they have to talk to us. Denial. I think denial, honestly, is the biggest one. People think it won't happen here. It won't happen to me. When the terrorist attack happened at the Inland Regional Center, I've been doing this work since 2012, and I never in my life thought I would hear the President of the United States say the words San Bernardino or Redlands. It can happen anywhere, whatever it is. But people think it won't happen here. It won't happen to me. If it does, FEMA and the government are going to come and save me. They're going to come and help me. That is not true. Not that they don't want to. They don't have enough staff. And there's thresholds for help from the federal government. That's why you always see them declare an emergency, a state of emergency. That's the first thing you have to do at the state level, the county level, the state level, in order to get federal help. People don't understand the system and how it works. They think, oh, I'll be okay. FEMA's gonna come, they're gonna help me. Or they just think, if it does happen, there's nothing I can do about it anyway. And they can't. We are constantly preaching, we have this little acronym, yo-yo. I mean, we just recently had coffee cups made with yo-yo, you're on your own. And so we are trying to tell people, even if you're not completely prepared, having some level of preparation is going to be better than none. Well, we've seen it. I mean, I think about the Blue Cut fire that we had in Phelan, and, it shut down the whole 15 freeway to the point that the governor of Nevada said, hey, you gotta open up the freeway, to Vegas, right? It looks like devastation. It looks like people being so traumatized that they can't think. Even when you ask them, do you need anything, or how can we help you? They can't think. It looks like one situation, a 70-year-old woman sitting in the middle of the debris pile that used to be the farm that she was renting. It looks like her being so traumatized that she almost runs out in the middle of the highway. It looks like her falling on my shoulder and crying every time I saw her when I would just say good morning to her. It looks like us calling 911 and sending her to the emergency room. because we were concerned that she was suicidal. When Palisades and Altadena fire hit, and I was at an event, and some of the leaders were there, and it was a month later, if maybe 6 weeks later or so, and I was talking to one of the leaders, and I could see in his eyes he wasn't there. You know, I think it's important, but disaster preparedness is very basic. Not everybody can advocate. Not everybody's going to advocate. No, but not everybody has the time or the, you know, the opportunity, right? But the basics: have a go bag, one in your car in case you're out and something happens. Have one in the house. Be ready to go evacuate your house within 10 minutes. When you get that knock on the door and they say you need to evacuate now, have that go bag, which includes all your important documents that you already have in the go bag, you know, so you can go. If they say stay, shelter in place, Boyle Heights, you know, they're shelter in place, right? Have enough emergency supplies that you can be in your home 10 to 14 days without having to leave to go to the store.
What are some items that you recommend?
Emergency water, okay? Everybody's kit needs to be different, depending on you. But emergency water, because we can't live without water, right? And if you use plastic bottles, which we don't recommend that you use plastic bottles, but if you do, they're going to be impacted. The plastic is going to be impacted by the heat or the cooling, right? And so you have to switch them out every 4 to 6 months if you're using plastic bottles. But there's emergency water that will last 5 years. There's some emergency water in cans that will last 25 years, okay? And it's safe. People can go to our website. We actually have an online store on our website. If they just go to brcus.org, O-R-G, that's our website, and they can buy supplies there. But we also have a page for resources, free resources. One of the first things I created was an ebook on how to prepare based on a camping trip. You know, campers, whether they're tent campers or RV campers, they're typically in pretty good shape. You know, I know we repurposed all of our camping equipment to disaster equipment. You know, even me, and I do this, you know, it's like now everything is so modern and, you know, hey, and my gas stove has an electronic igniter, right? So you turn the button, you hear the click, 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 right? But if the power is off, you don't get a click, click, click. And so our power went off one day, and I'm like, oh, Edison will have it back on. You know, I'm a retiree from Edison. I'm not worried about it. They'll get it back on. Yeah, it won't take that long. And then it's like, wait a minute. It's taking a little while. Kind of getting hungry. Oh, no, microwave doesn't work. I have the fireplace lighter thing, and it's like, back in the day, you just used a match, and you just stick it on there, and it lights, you know. So, you know, people have to practice. They not only prepare, but then also practice so that they know what they can do. If you have pets, your pets need a go bag. Your pets need a shelter in place, you know, kit. You know, first aid kit. You know, simple things. Earthquake. I was talking about earthquakes earlier in the room. I would encourage everybody to get a little drawstring bag, backpack kind of bag, put a pair of closed-toed shoes in it, and a flashlight, and actually a crowbar, at least those three things in it. Now me, I have a pair of glasses in there if you know, because if the earthquake hits at night, you need to have that bag right next to your bed, because when the earth is shaking, and most people have windows in their bedroom or things falling over, you know, that picture that's right behind your bed that looks so great, when it falls over and hits you on the head, you know, stay in the bed until it stops shaking. Cover your head with your pillow, protect yourself, right? And then reach over, get that bag. Do not get out of the bed barefoot. There could be glass all over the floor from the mirror or whatever, right? And so it's simple things. It depends on what you have in it.
Yeah, because stuff can expire.
Yeah, things can expire, you know. I know in my car, I carry snacks. I call them emergency supplies. But I have snacks in my car just in case I get stuck somewhere. You know, I have a jacket, you know, in my car. I have a blanket in my car. I have a go bag in my car. You know, all of these different things, you know. So it depends on what you need. If you have medications that need to be changed out or things like that. Well, considering I'm one of those people, I'm elderly. Um, I hope people aren't being left behind. You know, the thing that comes to mind is if they have medical devices, you can be young or old, it doesn't matter, to have medical devices, be it, I don't know, you know, a CPAP or sleep apnea. You need to have a backup generator. One of the things we've been talking about recently was some cuts from the Public Utilities Commission for backup battery type of equipment, right? If you are in a wheelchair, a battery-powered wheelchair, and you can't evacuate it, you can't evacuate, right? That's a problem. I know Edison, if they're an Edison customer, that they have a program with backup batteries, but they also have a medical lifeline kind of a program also. And I would encourage people that have any kind of medical conditions to sign up for that program. Because you know, then you're on somebody's radar. Somebody knows you're there, you're out there. Yeah, there's several things with that. When a disaster, well, let's talk blue skies for a minute, because a lot of the problem has been insurance companies canceling insurance, depending on where you live, in a fire zone, a wildfire zone. Something needs to be done about that. Whether that's with elected officials and advocacy or, you know, it's a systemic issue, right? And people are getting canceled and then they have to get insurance that is twice the rate, if not more, right? On top of everything else you're doing. Food and medicine and gas, nothing's cheap. So you have that issue. But secondly, when a disaster does strike, you have all of the contractors that are coming out and saying they'll help, and they may not be legitimate. That's another thing. But the one that I think the people who are most vulnerable right now are renters who do not have renters insurance. It's happening a lot. The woman that I talked about who we had to send because of potential suicide, they were renting that farm. The owner put them off the property after the fire. And they did not have renter's insurance. So the owner was covered. The landlord of the apartments is covered, but not the residents, not the renters. We encourage everybody to get renter's insurance. It's not that expensive. It's not. I mean, you know, I understand considering today's prices for gas and food and everything else, utilities and everything else, adding one more thing sounds insurmountable.
That's cheaper than something like Netflix.
It has to be done. Protect yourself. Protect your property. The landlord's going to be okay. They have insurance. Yeah, well, one of it already took place. I missed it.
Oh, I'm sorry.
Yeah, it's okay. You did too. I really wanted to hear Janice Roos from CART talk about the impact of racism and having those difficult conversations. Because I think that's one. So, and the reason I'm saying that one is because I don't feel like we can come together as a community if we just know each other at the surface level. You know, I mean, you know that the saying, you know, people judge who you are in the first 30 seconds, right? But that's not who you really are. And if we can find the common ground, you know, I've never been in war, but what I've heard is the people, when they're in the trenches together, all that other stuff doesn't matter. That's their friend, that's their buddy. They know I've got your back, you got my back. We're in this thing together. We have to get to that level across the entire inland region, San Bernardino and Riverside County. Nonprofits, government, faith-based community, we have to stop looking at each other as different and see ourselves as a whole team. And we're a diverse team, and because we're a diverse team, we're a stronger team, right? So that's one that I think is really important. I am incredibly excited that they're going to Public Health Alliance of Southern California, one of our foundational partners. They're introducing the Inland Equity Grid, what we call the IEG. The Inland Equity Grid is an idea that I had in 2022 when we first started the summit. And we have not found a centralized GIS mapping system that has all of the nonprofits, faith-based organizations, public services in one place that you can query the system So we are registering as many agencies as we can across the inland region. We want to know who they are, where they provide services, what services they provide, and who do they provide the services to. So let me give you an example. When they cut the SNAP benefits for that period of time, I literally had one of the cities, one of the rural cities, call me and ask me if I knew where to get food. A city asking me. And so if we could have queried the system, we would know here's who provides here's who can provide food for your city. So they're introducing that today, and it's going to go from the Inland Empire. Our next phase is going to go across 11, well, really, I think it's like 9 counties, including Orange County and LA County. And then it's going to go statewide. It's data, right? And that's what Public Health Alliance is all about. You know, they already have the Healthy Places Index. And so if you haven't looked at the Healthy Places Index, you should, because we're focused on using data to tell the story. I think my support system, my faith is probably the biggest one. And I've learned how to compartmentalize. You know, I mean, you know, I hear the young folks say life be lifing.
Yeah.
You know, and so all this stuff happens out here, you know, and I feel like it's meant to be distractions to stop me from doing what I'm supposed to do. And so, you know, it's that kind of stuff. And my husband is really good at grounding me, you know, but I have a great support system.